At ZOVA, what we are is we are a clinic that specializes in getting people moving well. So we use a wide variety of techniques in order to do that. So you may receive some chiropractic treatment. You may receive some treatment that looks more like physical therapy. You may receive, acupuncture, taping, massage therapy. So basically what we specialize in is just looking at all the different manual therapy and healthcare fields and kind of taking what works and putting that all together to get people better as quickly as possible. That's a big part of the fun of working here, is when you have so many different things at hand, you're able to kind of freestyle and kind of experiment with patients, because finding out what's wrong with somebody is usually the easy part, but knowing exactly the right combination of therapies to getting them better, and that's kind of where really the art of chiropractic comes from. So, one patient may need dry needling, one patient may need more traditional Chinese acupuncture, another patient may need us to use our arthrostim on them because they don't tolerate, kind of a traditional chiropractic adjustment well. So, having all those different things available at hand really lets you kind of mix and match and find that perfect treatment recipe for people. So to the skeptics, usually what I say is, the proof is in the pudding, really. What we do, we offer short treatment plans. And most of our plans, if we don't really feel 100% confident that we absolutely can help you, what we do is we start off with what we call a trial of care. So you would see us anywhere from 2 to 4 visits. And if we haven't at least made a 25 to 30% improvement in your symptoms, then we refer you to someone we feel like can help you. So, there's a lot of people, I always hear people that talk about, I believe in chiropractic, almost like we're, the tooth fairy or something like that. And what I always tell those people is, I don't need you to believe in it. I need you just to experience it, and then you will see that it works. I traced a lot of my history back to a test that I took in high school. There was like an aptitude test that I took. And the two, highest things that they found was I really like to help people, and I really like to work with my hands. And chiropractic was really kind of perfect for that. So I had grown up with my father as a chiropractor, so I've received chiropractic since I was a baby. At first, I was really kind of resistant. I was like, I don't want to do the same thing my dad does, and I was looking more at physical therapy. But then when I saw with chiropractic how I would, be a full physician, how I could diagnose and treat and refer and order imaging, I really just saw that chiropractic was going to allow me to do the most for my patients without having to, use other people to get things done. And that's really what kind of helped me make my final decision. My goal is that a patient, after a certain point, will never need to see me again. And it's extremely powerful and empowering when patients learn how to kind of take their health into their own hands. And I like to tell them, I can show them the way, but really they're the ones that do the work, and it pays off in the end.